Make sure you get my good side, okay?
Good, thanks.
They can get fitted, I think it might have to order something. They get fitted. These are teenagers,
Right. So, and hope they're in treatment, so they're already hopefully hooked up with what they need. This is kind of a really we're trying to get them to know each other. First of all, make some friendships with someone that's going through the same thing that they are. We have a caterer that's going to do food. We have or she calls me back like 2 days later. So they put together little gift baskets, and she was like, how do something, or maybe even a photo frame, and we could, so this is the microphone, and she's got like, and so you can just leave it here, restaurant, kind of talk here, or and lots of other things. I mean, they're kind of going out now because this is like their Christmas party. And she said, we're just going to make 20 out. And she said, we're really hoping it's going to make even like a machine. It's a machine. We don't have it. She said, yeah. You know, I said, oh, yeah, perfect. You know, it just gives you the spirit of hope and these things. So, we may want to yes. Email and let me know their names and addresses, and go ahead and talk to them about that if they can interested. And tell them that I would call them, I'll call them to set it up, and then send them an invitation in the mail. Okay. So anyway, this is our first big project. But it's our first little project that we're working on. It's really going to be fun. Well, she'll have a Christmas one. I'm sure she'll I don't think she'll be mobile enough to go. So kind of. Basically, you two have Western America. Which is involving our little group, because, you know, we kind of were looking for college age kids that are just about to go to college. Now we're kind of, college can't go. I mean, you know, we're not doing that. We're not really open. Here we are.
Oh, do you need my book too? Just set it up.
I'm good right now. It just depends on who sits in.
Phone on vibrate.
How many people sit in.
Or no, my phone.
As soon as I get something to drink, I'll take my. Yeah, there's some drink. I thought we could sit right there.
Yeah, right. Until New Year's. I was going to text you. Let's get back.
Well, when your hair's short, you have to go before we.
I didn't go back to Ohio. I was working at Riverside, so I don't know if that was in the Air Force Reserve or Air Force just short.
It's right, yeah, it's about
Position open. She was covering me for a month. I'm gonna go. And they couldn't get fire schools, so I could put it there. They considered me going to so I flew full time and I was like, well, and 4 weeks, I think, yeah, and I went back to school.
Hey, how are you? Good.
I went to Ohio State first.
What happened was, I would stretch, finish one. 2 weeks of hair, 2 weeks of. Then I'd say cut it really short, make it 6 weeks, you know, so then I'd have 2 weeks of really short. So it's February.
Did we get it to the park?
And then follow by.
Stacey said she didn't have one, so I'm going to assume you don't have one that has the IBC on it?
No.
No, you didn't?
I looked on the internet for these for a long time and I couldn't find. Oh really? I have
She
her.
sent those and when I was doing my thing last night. And she sent me a whole box of these and the brochures and some
That's awesome.
ink pens that I gave Stacey and Heath.
I just couldn't find them anywhere on the internet.
She has them. She wouldn't give me them. She said it comes out of the spine. So you know, told my dad bring you
These are ours, right?
Yeah, we have 3.
Nobody can.
One of our right now. I've never go it's a false negative.
Well, mine was 2 years ago. It was very kind of at the beginning of just oh, the show.
You don't know where they are. No, English.
Hold on, I'm doing some maneuvering.
You're 60. Do you have any documents? I don't have any. We have Did you see the blue thing that was with it by chance?
What?
The little blue voucher.
It wasn't on there.
So tell me what I did with you.
Here it is. Sorry.
Awesome. You know what this is? Let me go
Are you really? And that's not we wanted to reason to just presentation say it. It's another decision.
You're much better than I
Yeah, he's
I think we'll go ahead and start, ladies.
Well, that too.
Well, 10, and I know that we all have tight schedules, especially at this time of year too. So, welcome everybody. I'm so glad that you're here. I'm Dana McGurk. I'm the Breast Health Navigator here at Texas Health Harrison Police Hospital, Fort Worth. I'm getting pretty good at that. And or Harrison Hospital. It is a mouthful. Anyway, I thought what we would do today is, I think most of us know each other, but I think we do have a few newcomers today. So if you will just start, we'll start over here. And if you'll just give us your name and where you are, and we'll just go around the table. Go ahead.
I'm Tricia Schultz. I am the patient navigator at John Peter Smith. I work for American Public Health, the Breast and Cervical Cancer Program.
I'm Maureen Maidbone, or in a Vale, and actually I'm transitioning to navigation of the pelvic health, the early engagement.
I'll make that name.
Chris is here.
No, I was just going to say one of my patients met you.
Pardon?
One of my patients met you.
Oh, okay. Did I leave an impression?
It was wonderful.
Tracy Ganger, I'm the nurse one navigator here at Nurse Fort Worth.
Jane Oderberg, Program Director at Cancer Care Services.
And what?
Across the street.
Across the street. And I'm Maureen Ashman, breast nurse navigator at Baylor Grapevine.
And I'm Jo Darling. I'm the oncology nurse navigator, all oncology, non-specific, and program developer at Irving.
Me, Katrina, and I'm a volunteer at Irving.
We love our volunteers. Yes.
I'm Betsy Booth, Nurse Navigator, Baylor Plano.
Oh, I thought it was Bill, I'm sorry. I'm Dorothy Head. I'm the Patient Navigator at the Center for Cancer and Blood Disorders at the Heath Clinic. Yeah, well, I'm the Clinical Education Specialist here. I run the Resource Center across the hall and also focus on prostate cancer.
Catherine?
Stevens with Long Creek Cancer Institute. I'm the coordinator for the local program and community outreach.
So she and I are working together with the STEPS program. Just, you know.
I'm Amy Pittman. I'm a soon-to-be 9-year inflammatory breast cancer survivor.
Jen and I want to be just like Amy when we grow up. I'm Stacy Heath. I'm a soon-to-be 2-year IBC survivor.
And I'm Jen Huey, and I work at Texas Health Southwest, nursing student, and I'm 1-year survivor by IBC.
They are also our speakers today, and I feel very honored that they're with us today, and it's going to be a great program. So I think what we'll do, if anybody needs to use the restroom, it's just right down the hall here. When you go out this door, make a right and then a sharp left, and you'll see it right there on the right. So right, left, right. If you did not get a parking pass, let me know. And we will go ahead and eat, and then we'll resume. We'll start our program. Should we say a quick prayer? Okay. Heavenly Father, thank you for gathering us here today. We have so many things to be thankful for, and our lives every day are so filled with many different avenues. And help us to take a deep breath and take one step at a time, and to enjoy the holidays and the reason for the celebration this month. Help remind us of that. And keep everybody safe in their travels and in their travels during the holidays. We ask that in your name. Amen.
Amen.
Okay. Everybody just help yourself. There's the tea if you haven't got it already. You just help yourself. And there's also a little little snack pack for you too. Oh, okay.
Because you have to be isolated. You have to be isolated.
All right, we are going to be ready. Is there any left?
The only thing that I would really like to see specifically is along with the pictures. Just so we have them on my pictures.
And I want you to do, because you said you didn't get to do the last one, I want you to do the
I think we'll go ahead and get started with the program so that we can see where everybody's in line. I know the girls all introduce themselves, and I'm going to let them tell a little bit about themselves instead of me reading something. So this is inflammatory breast cancer, and we have Jen Huey, Amy Pittman, and Stacy Heath. I think they know what they're going to do, so I'll just let them take over. And I forgot to say, this is Ron. This is Stacy's husband in the back.
Thank you for the free lunch.
He's our groupie. He's one of our biggest advocates, actually. So, as Emma said, I'm Jen Huey, and I'm actually getting my year mark right before Thanksgiving, actually. So, I just finished my first year of nursing school. I've got another year to go, but I'm actually still in current treatment. I am taking Herceptin, so it's infused hour and a half every third week, and then I'm stage 4, so my cancer is actually in my breast and in my bones. So I'm actually on Zanetta now every 3 weeks, so I'm in current treatment. So luckily the hair's grown back a little bit. So, so I'm also a mother of 2. I've got a 5-year-old and a 14-year-old, and they keep me busy, and school definitely keeps me busy, but I always try to find time to spread the word. So that's why I found my lovely friends, so they're here to help as well. So I'll let one of you introduce yourself.
I'm Amy Pittman, and like I said earlier, January 2nd, I'll be a 9-year survivor. I was diagnosed at 37 years old. I had a 9-year-old daughter, single, didn't know where to go or what to do. So we are thrilled that you ladies have all come about and can help people like us that didn't know what to do or where to go. So my daughter's now 18, and I am doing great. I'm out of treatment totally, and just glad to be here and glad to be alive.
I'm Stacy Heath. It will be a 2-year IBC survivor on January 21st. I was 34 when I was diagnosed, and I was stage 3 at the time. Then I had 9 months of treatment. I got 364 days of no treatment before my cancer occurred. It's now in my bones, in my lymph nodes, and in my lungs, but I'm in active treatment. I'm taking Taxol, Avastin, and Iridia on a three-week cycle. I'm on my 2-week break right now, so I'm happy about that. It's going to be my last bad hair day for a while, because I'm going to go get my G.I. Jane haircut after this, because it's going. But you know, overall, I'm handling treatment very well. Like Jen said, you know, we really think it's important to get out and talk about IBC. I consider myself to be a fairly well-educated person, and I never heard about IBC until I had it. I was misdiagnosed, just missed it in October of 2008, and then it, finally got diagnosed in January of 2009. So it's really important that, as first-line caregivers, you guys know what to look for. You're going to see some pictures in the presentation today of imaging and photos, because the signs are so subtle. So we're really glad you're here.
Amy, can I ask, did you have any metastatic disease?
No, mine was stage 3B, and was in my lymph nodes, but they removed all that. So.
Okay, can everybody hear me? Okay. So basically today we're going to cover the common symptoms as well as detection and diagnosis. So like say study, we'll be seeing some images, and we're going to go through biopsy, staging, also the different treatments that are available, as well as the summary. That's kind of our motto here is teach it, treat it, beat it. And then we have a slide that has additional information and references. We've also provided a brochure specific to IBC, as well as one of our IBC pins, so support those. And if anybody sees it, feel free to show them the brochure and let them know what IBC is.
And this presentation is available out on the resources link on the Tarrant County website as well.
And then we kind of put a personal touch at the very end. You'll see faces of IBC, because we just wanted to let our general audience know that it's not just postmenopausal women. It's women of all ages. And unfortunately, we've heard the case of diagnosis at the age of 12. So it does happen in young kids as well as older adults and everything. So,
Were you going to talk about your mom?
if you'd like me to. Sure. Just to give you a little bit of family history, well, I was diagnosed at 33 and now 34 until that happened. But I came from a strong history of breast cancer. Both maternal and paternal grandmothers both had breast cancer, one premenopausal, one post. My mother was diagnosed at 35 with inflammatory breast cancer at the time. We're not sure that they knew it was inflammatory. I've been trying to get records, and I think I actually found one where they did specifically say IBC, and this was in 1984. She was diagnosed and passed within 9 months, just a few weeks after my 8th birthday. So it was kind of devastating when I heard, my dad tell me, IBC, I think that's what your mom had. So it was definitely a struggle and everything. So I feel very blessed that I met the girls that I have, because they just inspired me so much. So I'm here to spread the word as well as they are, but unfortunately, I did the BRCA testing, and BRCA 1 and 2 negative. So we don't know what mutated from my mother, so I'm working with a research doctor actually in Washington, at George Washington University, who's trying to get her pathology as well as mine to see if we can try to figure out what the link is. But so far, we don't know what mutated in me that caused mine, so hopefully. So, who wants each other? And then, sorry, this is the first time of us presenting it together, so we're a little unorganized. So, how many of you have actually heard about IBC before today? So pretty good.
Y'all are an educated group.
Yay.
Give yourselves a hand.
Well, IBC is rare. Breast cancer, when I was diagnosed, I was told that of the thousands, and probably beyond thousands, of women that are diagnosed each year, IBC only makes about 1 to 2% of those women diagnosed. So it's definitely rare, and it's unfortunately one of the most aggressive types of cancer. And because it is misdiagnosed quite commonly, it's one of the deadliest. So education is definitely the power to get the word out.
How many of y'all have worked with an IBC patient as a navigator?
The inflammatory is, the reason why it's called inflammatory is because the breast does look inflamed, it's red. It's, a lot of the misdiagnosis is because people think, oh, you have an infection. Doctors put you on antibiotics like they did me for 2 months, and my breast just kept getting larger and larger and larger. And so it does swell, redness.
Mimics mastitis.
Does. So a lot of times it doesn't have a lump. Sometimes it does, but it grows actually in sheets more so, and then it also, the skin can become dimpled like orange peel. And so that's part of the reason why, because they're like, oh, there's not a lump. You can't have breast cancer without a lump, and you can. So.
And just to kind of add a little personal touch, I actually found the lump, and with the family history, I was used to doing the soft breast exams, and I had an mammogram at 21, 25, and at 30 I had one every year. And unfortunately, most of the time it will not show up, on a mammogram. Ultrasound sometimes, if there is a distinct lump. So I'm one of the rare that actually have a lump. So I, in a way, feel fortunate, kind of catch-22 that I found it, or I, may not be standing here today. A week can make a difference in life or death with IBC. So I had a distinct lump when I found mine, and I immediately called my doctor, and as I said, they got mastitis, and I went to a radiologist, and he did ultrasound, and he was like, I really do think this is mastitis, because the skin was thick, and had a little bit of redness, not much, just looked like I had scratched myself, and that's all the signs that I had. And so they did put me on the antibiotics for a week, and I was like, this isn't helping. So I became pretty insistent that I see someone, and so they sent me to a breast specialist for the biopsy, and then that's when I got the news that it was indeed cancer. So,
and one thing is, with IBC, it is more commonly diagnosed in younger women. We were all in our 30s when we were diagnosed. Prior to that, I hadn't known anybody younger than late 40s who had even had a brush with breast cancer, and it's one of the more aggressive types of cancer, and that also goes along with coming into the younger women. So this is a lot of symptoms. We've been kind of talking about them a little bit. Maybe what we'll do is go down the list and say, we can just kind of raise our hands so you can see what we had. This is a long list, then we'll show you some pictures. Warmth and swelling of the breast.
Yeah.
I had that, but I didn't have it initially. I didn't have it until about 3 months out. Redness or pinkness that, again, may look like mastitis. And if it's not a woman who's pregnant or nursing, it's not mastitis. And I know I'm not a doctor to say that, but I've just heard that over and over again. And they send us away with antibiotics, and a couple weeks and the cancer progresses. So just if you can remember one thing, that's what I would ask you to remember. Itching or pain in the breast that wouldn't go away.
Mine was excruciating, and I would itch so bad it was like I'm going to take the skin off, but or just a sharp pain like in my side of my breast.
Because I had, with me, like I said, I had an initial inclination that something was wrong in October of 2008 and went in for my well woman exam, and they said, oh, it's probably nothing, but we'll throw the book at it and do a mammogram and an ultrasound and rule everything out. All I had was a little red spot and itching. Then as time went on, it started to feel like I was getting a stabbing pain. But again, they had told me, well, it could be your underwire bra, could be your detergent, could be, all these different things. So I wasn't alarmed. Dimpling of the skin, when I finally got diagnosed in January, definitely had dimpling of the skin. A bruise.
I had a little bit of, I had the redness that looked like a line, but I noticed I had a little bit of inflammation, so mine wasn't presenting like the standard, I guess, case of IBC, but I did notice I had like a purple hue, almost like a very light bruising, even though it wasn't tender to the touch, it didn't itch. But I did notice that kind of once they said it is cancer, that I kind of did have a little bit of bruising, but not bad, just a little hue basically.
Changing the color of the areola. I didn't have this, but I've talked to people who have.
I have. A lot darker and down, I don't know, because my nipple ended up being inverted.
That was really my clue that, whoa, something's not right here, was my nipple flattened out. And I was, busy with life, and I was like, well, I'll get back into the doctor. And fortunately I did. But that was my big clue. I also had swollen lymph nodes under my arm toward the end, but I didn't really realize it. I was, just got a little fat there. You don't think it's anything big.
I had swollen lymph nodes, but I didn't know they were there until I went to the doctor, and then she felt it, and I was like, well, that's a little tender, but I never paid attention to it or even realized that they were swollen until they were pointed out to me. So.
Weakness in the arm. I was working on my MBA, and I had just gone back to school the semester before, and I was noticing that I was having trouble keeping up with writing notes. But again, I just didn't put 2 and 2 together, and it was all related to the lymph nodes and to the cancer, but it just didn't add up until finally everything came into the picture. And then finally I was probable, and that was me. So here's what some of these things can look like. And as you've heard, we all have very different symptoms. So these are just some samples. This was my breast in the beginning. It just looked like a bug bite. I mean, really just about the size of, maybe the size of a quarter. Then the skin kind of, you can see where the underwear bra goes. The skin got a little thickened. But again, I had my mammogram and my ultrasound that said I was fine. So I was fine. I didn't feel bad. I certainly didn't feel like I had cancer. Then in January, my nipple flattened out. My axilla swelled, and you could really tell that something was wrong. And unfortunately, my mom sent me and I had some edema there. My skin's light, you can't tell, but you can really kind of see the photo orange on that picture up there. But this was from one little spot to this in 3 months. By the time I was diagnosed, they said my tumor was 9 centimeters. It had basically just kind of taken over the whole breast. It didn't feel like a lump, it just was like thicker skin on the breast. Fortunately, I didn't really have much comparison to know how huge that was in terms of a tumor, but it all through chemo, it all went away. But that's just kind of some examples of what symptoms can look like if you see women presenting with something like this, or with a darkened areola or bruise or something. It can be very subtle.
And then the clinical presentation of IB symptoms can lead to diagnostic testing to rule out IBC. And again, as I said, it comes in sheets, so the radiologist has to be trained to look for the sheets. Usually they see the thickening of the skin, they automatically think infection, which if they've never heard of it, I understand and respect, their education. But without the lump, mastitis is the number one thing because they don't think rare type of breast cancer.
Young women, dense breasts.
Yeah. Yes.
Out of these two images, which one would you think would be the IBC? This is a right and left breast of the same woman.
The one on the right that was so.
It was right, it was the right.
Click.
It's not.
So it's actually the left.
Wow.
This is just a little bit more on, radiologic signs. We've all gone back and looked at our mammograms and said, "Yeah, I can see it right there." The thickening of the skin is one of the signs. You'll see a big, kind of a fluid gap between the borderline and the rest of the tissue. Another is, kind of diffuse thickening or suspensory ligaments thickening. These are images that we pulled offline for diagnosis, for diagnostic purposes. Our mammograms didn't image too well into the copier, but it's there, it's subtle. The clinical presentation is much more dramatic and easier to detect. But from my images from October to January, if you go back and look, you can say, it was here. It was here if you were looking for it. Okay. And the lymphatic obstruction and I'm probably going to say this wrong, lymphadenopathy. The swollen lymph nodes are really a big tip-off and a very common thing with IBC because it's traveling through the lymphatic system.
Jen, you want to talk about that? Sure. This is an image of the breast. We're kind of looking from a top view that shows the cancer lighting up. Basically, we like to say lit up. There's probably another term, but it shows here where it's lit up. And to be honest, I had my first PET scan. I think it was October or November, and I knew there's PET, there's MRI, and I finally asked the technician what's the difference in PET or MRI, and he explained that the PET scan, they inject you with a high dose of radiologic glucose, and that binds with the cancer, and that's what makes it quote unquote light up. So it's another diagnostic measure, since ultrasound and mammograms don't really work. Really one of the key elements is to push the CT or the PET scan
Or breast MRI.
or the breast MRI. Or I think new. I have yet actually. I need to find a place that does them, that kind of puts you in a machine. You just kind of feel like you're going to fall off the table that actually images, and they said that's really good for detection of rare types of breast cancer. It's not as invasive as a mammogram as far as pain involved in.
And I'll say, when you have a breast that has IBC, a mammogram is torture. Torture, it is.
But sometimes, depending on your insurance, it is hard for women to get the proper imaging that they need because the insurance doesn't want to cover it, and there's a lot of paperwork. And again, time is of the essence, but it's something to definitely try to advocate for them is to push, that you need to get this done, and maybe help them if you don't have access to try to help them schedule those appointments. Because when you get the news, you're devastated. You don't think straight. You've got so many things thrown at you, and I commend every one of you here because until I met Dana, I didn't even know that you guys existed. And I would have loved to have had someone in my corner just to kind of help me, navigate. What do I do? Who do I see? And everything, because your world literally just turns upside down. So you just you know, take in what you can, but you only hear, you know, a fraction of what they tell you when you go in. So I took a lot of notes.
Well, and also, you know, with inflammatory, they are doing a lot more tests. I ended up doing a mammogram, ultrasound, ended up doing an MRI, and then the, you know, biopsies. And so they're trying to, you know, verify, because a lot of the stuff is not verifiable because it doesn't show up. So your head is spinning. And then before, like, I was diagnosed on January 2nd with the breast surgeon, met with the oncologist on the 3rd. I had my first chemo on the 18th. Well, between the 3rd and the 18th, you know, you got a couple of weekends there. Then they had to do, you know, all your bone scans, mugga scans, MRIs, blah, blah, blah. And so every single day I was, you know, I went to UT Southwestern. I was over at Zale Lipshy or UT getting scans or something done, and I didn't know if I was coming or going. So, you know, you do get a lot more tests and a lot more thorough. Once they figure out it's inflammatory, then everybody's kind of in a, you know, panic rush mode. So it is a little bit more than just having, you know, breast cancer. Right, garden variety.
We just talked a little bit about the biopsy process here. You guys are probably all very familiar with it. With the core needle punch biopsy, with excisional biopsy, I wound up having to have 2 biopsies because the first one came back negative, which, well, that was great news. That was a great day, but it wasn't right. Fortunately, the doctor said, you know, this, symptomatically, clinically, I know we just don't have the right sample, and said we need to do an excisional biopsy. And that's the one thing I would say is if there's a recommendation on punch biopsy versus excisional for inflammatory, to probably just go ahead and go for the excisional first, because there's a chance you're not going to get what you need with the punch biopsy, and then you're just delaying things again.
And I just wanted to point out on the biopsies, because IBC does affect the skin, but it's important that they get that skin sample as well, because that helps with the staging and kind of know where it is and how they need to treat it. So we kind of have that listed as well. I had a puncture biopsy and it came back positive, and then we had to test to see, you know, what was driving my cancer, and we'll kind of talk about that in just a minute.
Yep. And you know, you guys know all about breast cancer staging. Just it's important that with inflammatory, you're automatically at 3. You know, it's your advanced breast cancer at that point, because it's already gone through your lymphatic system. It's traveling. You got to get it quick.
Yeah, and also when I was diagnosed, that they said you start out at 3D, because by the time the symptoms, you know, do kind of rear their ugly head, as I like to say, you're already that far along, and that's why treatment is very, very crucial to get them, you know, to their physician and the oncologist, and get all that stuff started. Because, you know, my oncologist told me, you know, that had I waited another week, I may not be standing here, because it's that aggressive, and that really opened my eyes. And I was totally like these ladies, and I had thought I knew everything with cancer, because I was just so, you know, prepared and, you know, ready, but, you know, I knew how to do the exams, and I was doing the mammograms and doing everything, and, you know, those kind of knocked me down, because I never heard of it. I kind of felt ignorant to the fact that I didn't know what it was, and nobody else did. And so it's definitely important that if you see these, you know, clinical manifesting signs, that we act quickly with them.
Amy, you want to talk about treatment protocol?
Well, treatment protocol with inflammatory is a lot different than your normal breast cancer. You have chemo first. You're trying to, you know, shrink everything, because if they went in there to start with, then it could spread even worse.
Well, and that's when you guys had your biopsies, did the cancer go a little crazy?
Yeah.
Like, yes, yeah, just cut it. You know, cutting into the area where you've got it makes it get angry, I'll say. So
Yeah.
imagine that on a big scale.
Yeah. So, like for me, I had 4 rounds of chemo. I had the adriamycin and Taxotere, and then I had surgery is next. And then after I had surgery, then I had another 4 rounds of chemo, and then I had, I guess, 36 rounds of radiation. And so after all that, I was on, ended up, because I'm BRCA2, then I went ahead and had my other breast removed, had a full hysterectomy, and they started me on tamoxifen, went through tamoxifen, and then was on Femora. So I was on some kind of medication for 6 years. So because I was PR positive, then that's the regimen they gave me for the medication. Stacy, our prize child, is triple negative. So that's even harder.
So that meant after 8 rounds of chemotherapy, surgery, and 30 odd rounds of radiation, I was treatment free, but I didn't have the safety net of anything as a preventative. So that's, you know, I knew my odds of recurrence were higher because of that. I've been focusing on, you know, low fat diet, low calorie diet, exercise. But here we are, and you know, I'm in active treatment again, and I'm living with cancer, and that's another thing too, is people, probably not the folks in this room, but a lot of people don't recognize that there are a lot of people living with stage 4 cancer, and knock on wood, living longer and living, you know, better quality lives. So that's definitely what Jen and I are after.
Yeah, absolutely. Chronic, you know, I guess what they call it, because you're in the
It's chronic disease management. I joke with Ron that I had lottery odds, and a thing I didn't want to win. You've got 1 to 5% odds of getting IBC if you get breast cancer, and then about 15 to 20% odds of getting triple negative. So you combine those, and I figure I got an A.
And then we're all a little different because I'm HER2 positive, so I'm protein driven. And unfortunately, we can't get mine under control, so I have not had surgery yet. That's why I'm in current treatment. I have been for a year, but I was told once I do have surgery that I would have radiation. And HER2 is kind of the newest thing where they found some drugs that will help. So my doctor told me that when I came in, had I come in 5 years earlier, she would have given me less than 5 years to live. So she kind of felt like she was a kid in a candy store since we had new drugs for HER2 positive. So it's still kind of new. So I haven't even gotten to the targeted hormone therapy for HER2. So I'm sure they're out there, but I haven't reached that point yet. So
Well, you're getting Herceptin.
yes, I am getting Herceptin as my treatment, you know, to kind of hopefully systemically slow things down, because with stage 4, the goal is to contain and live with cancer. There is no cure for stage 4. It's just containment, and control. So we'll always live with cancer, but I like to say just because cancer has us doesn't mean that we have to have it. So we just live with it and do the best we can. We want to be like Amy, though.
You can still drink margaritas, right?
My doctor prescribes those every night.
Stacy, you said you had neoadjuvant. Did you have adjuvant chemo?
I did not. I had 8 rounds. I had 4 rounds of adriamycin and Cytoxan and 4 rounds of Taxol. I had a pathologic complete response to treatment. They took everything out, 16 nodes, 0 positive. But
And sometimes they do. It depends on what your pathology says and scans. But they kind of have what they call mop-up cleanup. Sometimes while you're going through radiation, they have you continue on a systemic chemo. It depends on where you're at in your treatment and what they think. So it's not uncommon to have the mop-up cleanup during radiation or